Did you know that there are intraocular lenses, or IOLs, that can be adjusted to your specific vision needs post-surgery? In this episode of OCuTALK, ophthalmologist Reza Moradi will explain what light-adjustable lenses are, what makes them different from traditional IOLs, what the changes in protocol is for post-surgical procedures, and the customization they provide. Dr. Moradi?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and welcome to OCuTALK. Today, we're going to be talking with Dr. Reza Moradi, who is with Iconic Medical out of Newport Beach, California. Dr. Moradi, nice to see you.
Hi, Thomas. This is Reza. Thank you for inviting me. I'm very excited to be with you and your audience today.
Oh, very good. Can we start by just introducing yourself? I know you're out of Newport Beach, California, but how did you end up in ophthalmology? How did you get into this field? What's your background?
Longest story, after finishing my ophthalmology residency at California Pacific Medical Center in San Francisco, I pursued a clinical fellowship in cornea, uveitis, and LASIK surgery in Boston. I went to Top Medical Center and OCB at MGH and finished a 1 year of fellowship. And I worked at San Francisco for a while as part of a middle-sized private group of ophthalmologists in San Francisco and some of the counties around San Francisco in the Bay Area. But I decided to open my own practice. And after doing my search, I chose Orange County to be closer to my family and friends here. And now I have my own practice in Newport Beach in California, and we are focused on doing cataract surgery, cornea, and dry eye treatment in Newport Beach, California area.
Oh, very cool. Well, that sounds exciting. And specifically today, we wanted to talk about light adjustable lenses, is what I've got on the sheet. Now, I think our audience may have seen other types of light adjustable lenses before. I think there's a brand called Transitions that has a coating on the glasses. When you go outside, they sort of turn dark. Is that what we're talking about today, or are we talking about something different when we're talking about light adjustable lenses?
We are talking about something totally different. So it's not even comparable to those adjustments that you mentioned. So the photochromic lenses or transitional lenses or progressive lenses that people have been using on their glasses. Those are cool technology that we have been using for a while, but this is something that we use when we are putting a lens inside the eyeball. So when we are doing the eye surgeries and like cataract surgery or refractive surgery to help the patients to see clear or get rid of their glasses for distance, near, those type of surgeries, these are the lenses that are used for that type of surgeries. And this is kind of like the first in their own kind, and we never had this technology available before, and that's why it's very exciting.
So let's take a step back real quick for the audience. I think everybody's familiar with what cataracts are. We've talked about them on the channel before, but everybody knows that you can have surgery to remove them. But when we talk about an IOL, an intraocular lens, right? Maybe everybody in our audience isn't familiar. Can you describe just real quick what a standard IOL is, what its function is, and then maybe we can talk about how that relates to light adjustable versions of the same.
So the eyeball is like a camera, those old camera which has a lens, and the lens job is to just kind of focus the image and put them in the back of your eye, which is called retina. During the cataract formation, the natural lens became cloudy, and we do cataract surgery and take out the cloudy lens out of your eyeball and put a new lens in the eye. And the job for the new lens is to just kind of like collect all the images and information in the world that you're looking at and just kind of put them back and focus them as an image in the back of your eye, which is called retina. So the power of this lens is very important because the power that you select, if I pick a lens number 21 versus number 22, for a patient can be a totally different experience. So it's just one diopter of numbers, but they might need glasses. They might not be able to see clear at distance or near, and they just gonna give them a lot of confusion. So that's why the power of the lens that we put inside the eyeball is very important in cataract surgery and refractive surgery. And that's why all these technologies and advancement has been in the market, and people are excited about the new changes that we have available now.
So, would it be fair to describe an IOL, at least functionally, sort of like an internal contact lens, right? That a permanent contact lens almost that's inside. I know that's not exactly what it is, but for the layman's, for the audience, that you're actually putting a lens inside the eye permanently.
Correct. It could be perceived as like that. So because you need a lens to see the world. If you don't have a lens inside your eyeball, you need a very thick glasses to just kind of like help you to see. So these small lens that we put in your eyeball, which is about 5 mm, so they do a lot of job for you on focusing the light in your eye. So it could be just perceived as a kind of like a permanent lens that is placed in your eye. Obviously, the shape of that is totally different than the contact lens, but they do the same job. So the contact lens are focusing the light for you and just gonna like help with the refractive error that you have. The IOL is also a different level of just kind of like correcting your refractive errors.
That's a standard IOL. Like the goal is to focus the light. And there are different ways that you do that. Like you said, the powers matter. And every eye is different to some degree in how you might focus that light. How do light adjustable lenses differ from what you might do in a standard IOL?
Sure. So over the past 30, 40 years, ophthalmologists have been trying to just kind of like be very accurate on selecting the number of the lens that they are putting in the eyeball. We have a lot of formulas, a lot of sophisticated devices that do measurements prior to surgery, hoping that during the surgery, we deliver that goal. So, but these formulas are based on the normal population. If you have shorter eyeball, if you have longer eyeball, if you have done LASIK surgery in the past, or if you have irregular astigmatism or high astigmatism. So some of those can interfere with the number that we pick and put in your eye. So if you have astigmatism, we put a toric lens in your eye, but that toric lens has to stay in a certain angle and degree in your eyeball. If they move, the result is gonna be unfavorable. So, but whatever we used to do in the past, we pick a lens, do all the calculation and pick a lens and put it in your eye and hoping that lens does not move and the number is a good fit for your eye. But when you go out, in reality, that number might not be the best option for you. But still, the patients need glasses or they need another surgery, LASIK surgery, to correct the remaining refractive error. But the light adjustable is the first type of lens that give you the option to put the lens in their eyeball, do the surgery, let them heal, go out if the lens want to move, if they because the lens position in the eye change after the surgery during the healing phase. So when the lens find its place, and it's just kind of like the chance of moving the lens is very minimal. And in reality, the patient can experience what is their vision right now. Are they happy with driving? Are they happy with watching TV? Are they happy with playing golf, watching computer, working with the cell phone? If they are not, then you have the option of adjusting the power. So this is the beauty of these lenses. 1 month after surgery, you bring the patient in and just see what is wrong with their numbers. If they are happy, fine, you can just go on to lock it in. If they are not happy, then you have the option to adjust the number and fine tune that to the point that the patient is happy and the number is matching their need. Some patients, their goal is to just come out be able to drive very good. Some patients' goal is to just come work with computer. So it depends on their lifestyle. You can adjust that and make sure that they are happy. And then you can lock the number. And on top of that, it does have a lot of benefit that I can talk about that in the future.
Yeah, absolutely. You know, so help me understand, right? Because to me, that seems like a game changer, obviously, right? Because, and even for a layman's, right, to understand what we just talked about, that you're physically, surgically putting a lens in somebody's eye, right? There's no going back and, you know, let's just tweak it a little bit to the right. You know what I mean? Like, so how... Doctor, frankly, how is that possible? How can you adjust it after the fact? How does that work?
So that's the beauty of these lenses. So these lenses are made of silicone, and there are some macromers inside those lenses that after the fact, so you can adjust them with shining some UV lights to them. So there is a machine called LDD, light delivery device, that after the surgery, you do all the measurements, you dilate the patient pupil and just figure out, okay, they need to be adjusted a little further for distance or near, and you put that number in the machine, and they sit behind that LDD machine. Takes about 90 seconds for the device to shine the UV light to the lens, which is inside the eyeball. And that UV light can change the shape of the lens by affecting the macromers inside the lens. So the power of the lens can change. If they have any remaining astigmatism, that can correct their astigmatism by reshaping the lens inside the eyeball. And then they go home and come back in 3 days. And if they are not happy, you can do another treatment and just go make sure that you get closer to what they need to be. And after you reach the goal, so then there is a locking process that you do the same thing with the LDD machine, but just different setting. And that number is going to be a fixed number inside the eyeball forever.
Okay, now that makes sense to me, right? Knowing how contact lenses are made, and they're made similarly, right? Like you're talking about a silicone material, right? And for the audience, what a lot of people may not know is that you're starting, when they make lenses like that, you're starting with a liquid, and then they're doing exactly like you said, using some sort of UV light to harden up different portions of it. So that makes a lot of sense that if you sort of left some of that soft, that you could later go in, shine a light on it, and adjust those different pieces based on the same way that you would quote unquote harden any other silicone with UV light. That makes a lot of sense, and it sort of makes me wonder, why would it seems like you would have more freedom and more adjustability. Is there any reason why you wouldn't just use that for everybody?
That's really, I think those are the best option that we have. Obviously, it's a new technology, it requires a lot of time and energy. The devices are expensive. I think the main limiting factor is the cost of those lenses and the time that the physician has to spend with the patient to make sure that deliver all those adjustment and whatever the patient is needing is asking for. So, but in my opinion, I think those are the best lenses that we have right now, and also give the patient a blended range of vision so they can have good vision at distance, intermediate, and near. So I would say not the best, one of the best options that we have these days.
Absolutely. Well, again, just as a layman's here, it seems obvious, right? Well, so let me ask you this, and again, for the audience's sake, when you're talking about cataract surgeries, insurances will usually cover cataract surgery. Now, typically what they will do is they sort of dictate, we'll pay for this lens and we won't pay for this lens. Are there any of those issues now, being that this is such a new technology? In other words, if I were talking to my doctor, are there any gotchas that I need to know about before I just start insisting on light adjustable lenses across the board?
Not really. I think you are right. The insurance covers the basic part of the cataract surgery for people who have visually significant cataract. But when it comes to new technology like light adjustable toric lenses or multifocal lenses, none of those technologies are covered by majority of the insurance like Medicare or the PPO insurances. And these are fantastic technology that if there wasn't any financial barriers, I would offer that to all my patients. But right now, because there is financial barriers, we discuss the option with the patient and let them choose which one they like. Obviously, with a standard cataract surgery, they're going to have a clear vision, but they will need to wear glasses. But with these type of lenses, they're going to be they have freedom from glasses and have better quality of vision.
So let's talk about the process in general, right? We talked at the top of the conversation about cataract surgery in general, right? We understand that you're going to clean out the cataract, we're going to replace the lens. Does it change drastically when I'm looking at light adjustable lenses? Obviously, there's that secondary step of the adjustment that's not possible with other IOLs. But is there any other differences in terms of the surgery, the recovery between the regular IOLs and the light adjustable?
The surgery itself is not different than the regular cataract surgery. The IOL shape is a three-piece lens for the surgeon, so definitely delivering a three-piece lens is a little different than delivering a one-piece lens. But definitely the surgeon, the surgeon is skilled, can deliver the lens safely in the patient eye, and the patient recovery is similar to standard lenses or other type of lenses. So they're not going to notice any difference. The only thing that is different is that these lenses are covered. They have a UV protection shield to protect the lens from UV light, the new generation of the lenses. But still, we recommend the patient to wear glasses after the surgery to protect their eyes from sunlight. I have some of the post-op kits that usually the patient get after the surgery. So these are the post-op eyewear that we give the patients to have with themselves. After the surgery, they are instructed to wear a pair of sunglasses, which is given to them right after the surgery. I don't put any patch or shield in the eye. I just ask them to wear these glasses till I see them the next day. And usually I recommend to wear these glasses whenever they are outside for the first month till we finish the adjustment process. The reason for that is that first generation of the lens, there was no UV protection shield inside the lens. So we were very meticulous about asking the patient to wear these sunglasses when they're outdoor. If they go outdoor, like spend a day at the beach or go to a tanning salon and just gonna like get exposed to UV light without protecting their eyes, there has been case report that the power of the lens has changed without having the proper adjustment. So that's the main thing that they have to do during the post-op period. It's not going to bother them, so they can still see clear with these glasses when they're outdoor. They can drive, they can do their normal activities, just having the sunglasses when they're outdoor. And there are some glasses that they can wear when they're indoors, just to protect their clear glasses that they can wear to protect their eyes from UV light when they're indoor. So I can put them on so you can see how they look like. So, and they have a little bit of power out here. So if they want to read, they can read from the bottom part. They're actually very good glasses, so they can keep them after the surgery as well. So it's just going to protect their eyes. But it's not mandatory. It's recommended. And other than that, there's no other limitation or difference in the recovery or healing phase. Everything is very similar to a regular cataract surgery.
So, doctor, what you're saying makes so much sense just intuitively, right? Like if you use UV light to adjust the lens, what's the biggest producer of UV light around us, right? The sun right above us, millions of watts all over the place, right? But now, doctor, this makes me question, if that's the case, what happens if I go out and stare at the sun for a minute? Like, is it possible to negate all the hard work that Dr. Moradi has done?
True. Yes, they can affect your the power of the lens negatively, and it might affect the outcome. So there has been few. I haven't had any case in my practice, but I have heard from some of my colleagues that they had one or two patients who have done such a thing and just kind of like get exposed to a lot of UV light, outdoor or indoor, depends on their activities, and that affected the power of the lens. So they had to either take out the lens and put a new one in the eye or do some laser correction surgery to correct the power. Because remember, these lenses, as you mentioned, so the number is not fixed yet, so it's flexible. So if you get exposed to UV light without any purpose, so the power of the lens can be changed. So it's important to protect your eyes from the UV light and let the power be adjusted with the LDD machine in doctor's office at a proper number. And then after the adjustment is done, we lock in the number, and doesn't matter how they get exposed to the sunlight in the future, the number doesn't change anymore because all those macromeres are kind of like activated and locked in. So the number is not going to change later in their life. So they are safe. But during the first 4 to 6 weeks after the surgery, it's recommended to protect their eyes from sunlight.
I have to say, like, seems like such an exciting technology, because being in the industry, I've certainly heard what you've talked about, right? Like, and as a surgeon, obviously you know this, right? Like, you've only got the one shot with the other lenses, right? And there's so many variables that could change slightly, especially when you're talking about torics, where we're talking degrees here, right? Like a little bit of a degree is a big difference, right? And so this seems like a real big game changer. Is there any candidate that couldn't use these lenses, right? Is there any reason for me not to be looking for these as my candidate for an IOL?
Yes. One of the main things as a surgeon, I do evaluate the patient pupil during the pre-op evaluation, and the pupil should dilate very well. If you have a small pupil and your pupil does not dilate well enough in the clinic, you are not a good candidate for these lenses, because let's say that during the surgery, I can use some devices to mechanically open your pupil, but when you come back to my office for the adjustment, if your pupil does not dilate well, so you are not a good candidate for the light adjustable lens. I think that's one of the main limiting factor for people who are not a candidate for light adjustable. Obviously, the second limitation would be lack of cooperation. The patient should be able to sit behind the LDD machine several times during the locking process and the adjustment process. And they have to be able to stay stable and no movement. If they have shaking, like if they have Parkinson's disease or tremor, or they have like physical problem that doesn't let them to stay behind the LDD machine. So those are the limitations that disqualify them for the surgery. So I just look at those conditions and make sure that they are cooperative, they fit behind the slit lamp and all the machines that we do in the clinic. And if I find them a good candidate, I sign them up. If they are not, I tell them, hey, you are not a good candidate. Let's just go with one of the traditional lenses that are fixed and not adjustable. So, and just hope that we reach the target. If not, then you can use glasses for certain activities.
So very good, and we talked a little bit about the risk. There are obviously risks with any surgery, right? And any IOL has certain risks that come with it. And we talked about some of the risks with this one, being UV light, some of the other things that easily mitigated, right? Are there any other risks specific to light adjustable lenses that we haven't discussed?
I wouldn't call it a risk, but these type of lenses, because they are silicone lenses, they are more prone to causing a little bit of opacification on the capsule behind the lens. During the cataract surgery or the modern cataract surgery, the lens is implanted in a natural bag that is inside your eyeball. If I want to use an analogy, so your lens is like an egg, and there's a shell that during the cataract surgery, we try to keep the shell and just take out whatever inside that and put a new lens inside the shell. So during these type of lenses, they are more prone to cause the shell to get opacified after surgery, and that can be easily treated with a YAG laser. Even for the standard lenses, 30% of the patient with the standard lenses that we put in their eye, they can develop posterior capsular opacification or PCO, and that can be easily treated with a YAG laser. But with the silicone lenses, this is kind of like more common. So we see that sooner, and that can be easily treated with YAG laser. And it's an outpatient laser treatment, takes less than 2 minutes, and they can see clear right after that. Other than that, I don't see any further downside or side effect from these lenses.
So, Doctor, is there anything else that we haven't covered on this very, very interesting topic?
Sure. One thing that I want to talk to my colleagues is about the difference of these lenses or the advantage of these lenses compared to the traditional premium or multifocal lenses. We usually don't recommend multifocal lenses for patients who have macular degeneration, glaucoma, or some other eye condition. But these lenses can be used on anyone because they don't decrease any amount of the light. So the traditional multifocal lenses, usually there's a reduction, 8 to 12%, sometimes 15% reduction in the amount of the light that get to your eye. But the light adjustable lens, 100% of the light get transferred to the back of your eye. So we can safely use and offer these type of lenses for patients with macular degeneration or early macular degeneration or mild glaucoma, so they are a good candidate for this type of lenses. Also, it gives you more power on correcting minimal amount of astigmatism. And these lenses can correct your numbers at very, very fine numbers. The other traditional lenses come out in like 0.5 increments, or they have limitation on correcting the astigmatism, but there is less limitation on correcting astigmatism and also correcting your vision with this type of lens. Overall, I think it's a great technology. We are all excited that the science is advancing so fast and helping us to be able to provide the best vision to our patients.
Absolutely. Well, Doctor, I know I've said this 100 times, but this is just really intriguing. As I said, I don't think it takes a whole lot of brain power to see how much of a difference that would make, to be able to make those sort of precise changes. Because again, I think we talked about that normally in a surgery, it's kind of the one go, right? Like I'm gonna absolutely be as precise as I possibly can in here. But as you said, as things heal, things are going to move, right? Like that's just the way the body works, right? And so being able to go in and make adjustments after the fact is such a game changer. And we talked on this channel during our talk here about where the availability is, that these things are available. And certainly if you're in the Newport Beach area of California, there's Iconic Medical that you can go visit Dr. Moradi right now and talk about these very interesting light adjustable lenses. So Dr. Moradi, thank you so much for being with us today. This was such an interesting topic. I really enjoyed it. Thank you.
Thank you, and I enjoyed talking to you, and hopefully this information was helpful for your audience.